KBLA Talk 1580. Yes, indeed, we are talking California. Pleased to welcome in to the conversation a partner and principal research at Eviteris. You know Eviteris because they worked with KBLA on their public opinion research project, but they certainly do that on a broad range of issues, including candidate and ballot measures, campaigns, American social and political values, public attitudes towards transportation, infrastructure, services, education, healthcare, and much, much more. Sha'Carri Byerly, good morning.
Good morning, Dominique. Thank you so much for this opportunity to talk about research.
Yeah, well, it's really specific, right? I know you guys talk about at Eviteris, you guys research all kinds of different things. But in this particular case, you are taking a look at how Black Californians deal with our health care, how we deal with the system, how we take care of ourselves. And this is something that was commissioned by the California Healthcare Foundation. But honestly, as much as I consider myself a health enthusiast and I track a lot of these issues, I was surprised by some of your findings.
Yeah, absolutely. One of the real strengths of this work is that we were able to talk to 3,325 Black Californians up and down the state about their views on health as well as their experiences in the healthcare system. It's never been done before, so we're really excited about what we found, some of which is consistent with what we know, and then other things that are surprising.
Yeah, that's right there. That's surprising, the fact that it hasn't been done before. Because honestly, we are, as much as we complain about how we're such a small percentage of the population, we have the fifth largest Black population in the U.S. in California. So we are a considerable chunk of the population. Surprising that no one has studied it yet.
That's right. And I think that people often overlook California as having a sizable Black population because on a percentage-wise basis, we're a smaller segment. But we're talking about millions of Black folks that live in California, in the Golden State. And so goes California, so goes the country. California really has an opportunity to lead on health equity. But when it comes to the population that is disproportionately impacted by inequities and discrimination, there just isn't a lot of data until now on what our population's experiences have been.
Right. So let's look at some of the stuff that, I guess you painted the problem and then went into solutions. We can look at the problem, but the things that surprised me were how many Black Californians, for example, are taking active measures to try to reduce stress. You found 80% focusing on our mental health, close to 80% was 79%. And getting those screenings and the preventative care that we're supposed to get, 77%. Those are pretty high numbers. It's not the picture that's painted of us in the media at all.
I think that's right. And that's why a study like this is so important to really dispel those myths. And I think the context is important. We know that COVID-19 had a devastating impact on our community. But at the same time, we also know that brought more of us in contact with the system. We also know that the efforts of Obamacare, ACA, also meant that more of us are covered than ever. So there's some bright shining notes here. The fact that we are connected to the healthcare system and we're doing our part to prioritize our health, particularly in the wake of so much devastation brought on by the pandemic.
Here's something that I found very surprising. 90% of Black Californians have health insurance coverage. I never would have guessed that. 83% have access to a regular provider, a doctor, nurse practitioner, whatever that may be. And over 9 in 10 have seen a doctor or a healthcare provider in the past year. That seems like good news, right?
Absolutely. It means that more people are actually engaged in the system. They have access. I think one of the troubling things we found in this study is that around a third have reported poor treatment by
Right.
a provider.
Yeah, we'll get to that. We'll get to that. I was just trying to lay out the picture of where we are, because if you've got 99 out of 10 people that have health care, but you're getting these disparate outcomes, then something's wrong. And I think that's where you were going. So let's talk about that when we come forward. What are the obstacles? If we've got the healthcare and we've got the doctors, why aren't we getting the results? And this 1/3 that Ms. Byerly is talking about, what does that actually mean in terms of our accessing the healthcare that we're clearly striving to get? So not only is Sha'Carri Byerly a partner in Aviderus, a public research firm, public policy research firm, she also knows a thing or two about California governance, political reform. She used to be manager of the California Governance Project at the Center for Governmental Studies. She's got a master's degree in public policy from UCLA's Luskin School of Public Affairs and a BA in government, if that wasn't enough, from Dartmouth. I say all that to say we started looking at the good news about Californians having insurance, having this relationship, some kind of relationship within the health care field. But you started going in on the fact that somehow there are obstacles. And you said a third of black folks, or almost a third of black folks, are reporting that they have been treated unfairly inside the system. Break that down. What does that mean?
That's right, Dominique. We asked specifically if people have ever been treated poorly by a doctor, a dentist, a nurse, or some other healthcare provider because of their race or ethnicity. And 31% say yes, they have been treated poorly. Racism in healthcare harms all Black Californians, but particularly women, those who identify as LGBTQIA+, those with a physical disability or mental illness, they bear the greatest burden. 47% of those with a mental health condition report poor treatment because of their race. 43% of gay, lesbian, bisexual, transgender, queer people report poor treatment. And the numbers go on and on. 2 in 5 women report adverse experiences because of their race. So, that's really troubling. And then we have a quarter who say they've actually avoided going to the doctor or the hospital because they felt they wouldn't be treated fairly. And that's really a problem. The system needs to change when we're seeing numbers like this.
Right. So I said all that about your background in governance. I mean, I know you're looking at the data and you're not making public policy recommendations necessarily, but it seems like the people are. And I wonder if there, is what's the path forward? I mean, let's take a look at some more of these numbers and say, like, solutions to me have to be embedded in these answers in terms of public policy, because these are not the kind of problems that just correct themselves.
That's absolutely right. And I think number one is, Black Californians are asking for, they, are calling out for community-based education first and foremost. 84% say that we need more community-based education on how to actually navigate the system, how to advocate for quality care. People want and need information about what their rights are and who to call, who to tell when they do have adverse experiences.
Yeah, well, it's a great point. I mean, and by adverse experiences, I mean, there's a story here that you share in the study research, about how that would play out. I mean, famously, we heard about Serena Williams, saying, hey, I think something's wrong. And here's one of the most famous and rich women in the world, certainly most famous rich Black women in the world, and they won't listen to her. So this isn't just like, I feel insulted. I was treated badly. It impacts the kind of care people are getting. Absolutely.
People are telling their providers that they're in pain and they're not being taken seriously. It's not just Serena Williams. It's, particularly women and maternal care. That's one of the areas that shows up, and people, are at risk of dying. We had one participant in particular who talked about having a C-section and telling doctors that, she was in pain, she was cramping, and she eventually was sent home, had to go back to the emergency room and they found an infection. And she said, if I hadn't persisted in speaking up about what I was experiencing, I would have been a statistic. And, that we know the statistics are startling for Black women when it comes to mortality rates. So it's a serious concern.
Yeah, I mean, and I also think, and this is me extrapolating, but still, when we read studies about how the adultification of young Black girls and boys, when we see, the way that we are stereotyped as being bigger, scarier, having greater pain tolerance, it becomes very concerning because you think about, what that perception is going to do to your health care. There's one story in here that I was referring to before where the woman said that she had told the doctors that she was short of breath, told the doctor she was short of breath, and he said, well, you're out of shape. You need to lose weight and exercise more. Turned out she was anemic and needed 2 blood transfusions and actually could have died. But the tendency is, with Black people, Black women in particular, you're fat, you're out of shape, you're just, you don't know what you're talking about, you don't take care of yourself. And according to what I'm seeing here, we actually are taking care of ourselves despite the obstacles or trying to do so.
That's right. And, people they share with us, they struggle with their weight. There are some people who are particularly talked about the intersection of stress, the burden of racism and discrimination, economic pressure and constraints, and how that hinders their ability to stay on track. And I think the woman that you're referring to in the report, she talked about the fact that, she's been overweight and trying to work on her weight for a while. And she went into that physician. The physician was familiar with her. And so, the shortness of breath was something new that should have been treated and paid attention to on its face. And it's something that not only impacts Black women. I just want to share another quote from a 37-year-old Black man from San Francisco Bay Area. He said, it's hard to advocate for yourself if people fear you. When you walk into a room, people already assume certain things about you, whether they think you're stupid, whether they think you're not smiling all the time, or you somehow have issues, even when you're experiencing pain, if you're not smiling. On top of that, it's hard to be taken seriously. So it's a constant uphill struggle, and it's not just health, it's across the board. So we see this portrait of people really striving to do better, to engage with the system, but they're encountering roadblocks. And one of the key roadblocks is racism, discrimination, prejudice, stereotypes that hinder quality care and fair treatment.
So you also asked participants what were their solutions. Not surprisingly, increasing the number of Black healthcare leaders, Black doctors, nurses, and other healthcare providers were high on the list. How do we do that, though?
Well, I think it starts with an investment. What participants told us, we did focus groups, 18 focus groups around the state, and people talked about creating a pipeline, starting with K through all the way up through 12 and beyond, making sure that we are letting young Black children know that the medical field, be it a physician, an advocate, a healthcare navigator, and a hospital administrator, that those careers are there. They also called for investments in financial aid to make it feasible for people to go to college and then actually afford medical school and all that entails. So, how do we get there? I think it's investment in the pipeline to make it a real possibility for young people to actually go into health careers.
Yeah, because I've had those experiences myself. Suddenly, I find myself doing first things first, the talk show with my doctor when they start telling me what this and that, their perceptions, and I just have to be like, nope, this, that. But I've brainwash myself. Just because a person has on a white coat does not make them the boss of me. I know, my body. I know my health sort of profile. I was happy to see that African Americans in California wanted more holistic approaches too, because that's one of the things that always saves us is when we have some agency and some knowledge of our own wellness.
That's right. And people talk to us about some of the things that they do, from, yoga to acupuncture to meditation to researching their own conditions and really getting educated. And they want more of that. They want more of those resources. They want the healthcare system to be open to alternative approaches.
Interesting here, they want to tie accreditation for doctors and hospitals to improvements in health disparities and ratings of patient experiences. So not just what are you doing, what are you doing according to your own self-certification or self-assessment, but what are you doing to close these healthcare gaps? That is a great metric.
That's right. And people wanted a mix of, consequences for bad behavior, but also some incentives to encourage good behavior, to encourage positive outcomes, and to really reward those providers and also institutions that are doing a good job.
And this idea of broader recognition of the history and existence of racism in medicine. I remember when I was talking with California's then Surgeon General about how many, not just Black people, but many healthcare providers don't have any sense of the history of racism, what they call the medical apartheid or whatever in this country, and think it's maybe all in our minds or our perceptions, or that somehow we're these primitive beings that don't understand the importance of doctors and healthcare, because they are just not simply educated about the history of Black folks in this country and mainstream medicine.
That's right. And participants talked about the importance of, being humble. And that goes back to the idea of, having a white coat does not make you better than the people that you're serving. And a recognition of the history and existence of racism in medicine can go a long way in not just sensitivity, but also the fact that there's repair that needs to be made for past harm.
When you do a study like this, Ms. Byerly, what are you hoping it will do? I mean, obviously, it's commissioned and folks feel like the California Healthcare Foundation has their reasons, which we'll find out about. But what is it that you hope as a researcher that the impact will be?
Well, we hope that there's a change in policy and practice. And we're really excited about the investments that California Healthcare Foundation is making and actually taking action on some of what people are calling for. Black Californians have shown their perseverance in trying to get good health, trying to pursue good health. They're ready to redouble their efforts, but it's health systems, it's medical training programs, it's state policymakers who have the authority to make this vision a reality, this vision of equitable care. And so, our hope is that they'll bring about change, because people share their feedback with us and they want us to do something with it. They want the system to change. They want these policies that they're calling for to actually be implemented. And
what were their attitudes? Were they, dying to talk about this, or was it hard to get folks to come forward about the state of our healthcare in California for Black Californians?
Well, it's always an ask for people to participate in research. There's skepticism. And if there's one thing I can say is, our firm, Ivitaris, has a deep investment in continuing to do research among Black Californians as well as other populations. So when you get the call, when you get the email, when you get the text message asking you to share your opinion and your experiences, please do so. One of the ways we were able to get such overwhelming participation is that we work through community networks. through radio stations like KBLA, through our Black newspapers, through our churches, but also through social media to let people know who we are and what we were trying to accomplish. And they honored us by, really answering the call and sharing their experiences. So there were challenges along the way. This was a year-long effort of recruitment and kind of building momentum for the study, and we're really excited about the results, and we hope earnestly that policymakers and advocates will listen and take action.
Well, just real quickly, just got a couple seconds here. Tell us how we can find you.
Absolutely. You can find me at Sha'Carri Michelle on Twitter. You can find us on the web at www.eviterist.com. And we are listening to Black Californians. So send us an email, drop us a tweet, let us know that you're interested in participating in studies. We'd love to incorporate Black Californians in our work.
Sha'Carri Byerly, thank you so much for joining me. Is happy to invite another voice into the conversation. She's a senior program officer, and she works with the California Healthcare Foundation to ensure that Californians, especially those who are in Medi-Cal, get responsive, comprehensive, and coordinated care. Catherine Haynes, good morning.
Good morning.
That sounds like a big job.
Very happy to be here.
It sounds like a huge job. Making sure that Black Californians, people that are enrolled in Medi-Cal, which, is very often are low-income folks too, right?
Absolutely. Medi-Cal is California's Medicaid program for people who have low incomes. But I want to say that California Healthcare Foundation in this work has made an exception. And this work that we're talking about today, the Listening to Black Californians Project, covers all Black Californians regardless of their income or insurance type.
Yeah.
And that is because inequity exists across the strata of the Black population in California.
That's a really good point, because when we hear statistics like, according to this survey, which has been done by your organization or been done by Eviterist, commissioned by your organization, California Healthcare Foundation, that 90% of Black Californians have health insurance. You think, that can't be including the low income folks, but apparently it does.
It absolutely does. I am a native of Black California. I'm in this target population, a native of California. California has really done a great job at leveraging Obamacare, expanding Medi-Cal or Medicaid, and the coverage rates are impressive. That's really good news.
Yeah, it is really good news. And, it's interesting. I was talking with author Linda Villarosa a couple months ago. She's also a journalist. And she really makes the case. She's got this book called Under the Skin, The Hidden Toll of Racism on American Lives and on the Health of Our Nation. She really makes the case that it is racism. It's not access, and it's not because we as Black people are sicker or cursed or there's something inherently wrong with us or we're lazy, we don't take care of ourselves. And this study seems to back up exactly what Villarosa is finding in her book. It's not that we don't care about our health. It really is actually the Black tax. It really is actually racism that is playing a huge role in this disparity in outcomes of health.
That's right. And I think that when we think about the effects of racism, it is the air that we breathe. It's all around us. And so the issues that affect our employment rates, for example, do affect us when we enter the healthcare system. And so the healthcare system is a kind of it's a indicator for all of the ills that racism cause, and they are embodied when we come into the healthcare system.
So, I was talking about this with Sha'Carri Byerly earlier in the hour, that we kind of
my partner in crime. She and Rodrigo are great.
Yeah, they have an amazing organization, and they do excellent work. Though we're talking about, this is the largest study, the first study of its kind around Black Californians and our health. So what was your purpose? Why would, obviously you could say, well, no one's done it, so let's find out what the heck is going on. But I'm sure there's more to it than that. What was the reason for California Healthcare Foundation taking this on?
Well, we began to take this on in the spring of 2020. We all remember that. We were closed, shut down because of COVID. The disparate effects of COVID were evident. George Floyd was murdered. There was a racial reckoning. And we looked at the work that we'd done. We'd done a lot of work with federally qualified health centers and in Medicaid. And we looked at the world around us, and we decided it was time to double down on Black health equity in particular, because whether in Medi-Cal or in the commercial sector, the outcomes were disparate. And so I was asked to develop a strategy to approach this, and I come from a background of public health and marketing and advertising, and my impulse was to listen first, to find out from the people who were experiencing disparate care and outcomes what was going on. And that's why we did this project.
And was anything shocking or surprising? I mean, I'm looking at this. I haven't been working on it since 2020. Just got it last week. But I'm actually really surprised by some of the findings. Was there anything that kind of shook you or surprised you in this?
Well, I've been working in health equity for about 35 years. So there were many things that didn't surprise me. I'll tell you a silly thing that surprised me. On a population level, though it varies by segment, I was surprised that people could get to their primary source of care so quickly, especially since I've driven the 405. But
yeah,
what really actually did surprise me was that our elders are more satisfied, generally speaking, with the healthcare system than the younger end of the group of respondents. And they are sicker, they go to the doctor more, but they are more satisfied. And given that what people are asking for is really relationship-based care, while I was initially surprised, I think it makes sense because I think our elders have relationships with their healthcare providers, and I think that's really important for continuity of care.
Mm-hmm. Yeah, I can see that. I can also see, and forgive me, elders, if I'm stereotyping you, but look, this young generation, Gen Z especially, they're not gonna put up with anything less than exactly everything they think they deserve, which is exactly everything that the dominant group in America gets. And I think as elders and middle-aged folks, perhaps African Americans are more used to compromising, and I wonder if that might have something to do with it. I mean, I don't know that there's any way to test that, but we know that a lot of Black Californians, from your survey and from empirical, conversations, that have felt disrespected, have felt they faced racism or been treated unfairly by our doctors. Maybe more Black doctors is the answer. I know for me it is. Want to talk about what you found, what the answers are, and how that fuels the work that you're doing. We'll do that when we come forward on KBLA Talk 1580. We're talking with Catherine Haynes. She's a senior program officer in the California Healthcare Foundation's People-Centered Care Team. We're talking about this study that they recently commissioned from Eviderus, which focuses on Black people, Black Californians in our healthcare, not just our outcomes, but what we're doing about it, what we ought to be doing about it. I was pleased to hear that so many of us, 90%, had health coverage. Pleased to hear that so many had a relationship with their doctor and were doing things like checking their, the various diagnostics, doing stuff for mental health, trying to reduce stress, all of those good things. We know, though, that there are hardly any Black doctors in California. I guess it's pretty much nationwide. We're around 3%. And we know that, according to your study, almost a third of Black folks feel like we've been disrespected or mistreated in the medical system because of our race. So where do we go from there?
Well, I think that there are three areas that of intervention, and California Healthcare Foundation works very, very closely with the state of California and to affect change, with the health system to affect change. And so where California Healthcare Foundation will go from here is this, directly to the halls of power, which are working very hard right now to connect the dots across the California retirement system for California employees, Covered California, which is our Obamacare exchange, and the Medi-Cal program, and the key regulator of managed care, which is the Department of Managed Health Care, and to really work hard on health equity. So they're lining it up. They have the ability to contract with health plans. They have the ability to require the collection report of race and ethnicity and language data, and we should talk about that because that means we have to give it, and to require providers to stratify their performance in delivering health care by race and ethnicity, and to either reward them for doing well or punish them for doing poorly. And in that, there is the ability to drive change in the system, because when money is on the table, healthcare systems change their behavior.
Yeah, that makes sense. Okay, so let's talk about it. Let's do it before we run out of time. We have to give it, you meaning data.
Data. Yes. When you go to the doctor, they will ask you often your race or ethnicity or language preference. All of those, and there are a lot, and they spend a lot of energy telling you that they'll protect the data, and that is true. However, people are reluctant, understandably, to give that information because race has been used against us. It's absolutely true. But unless we know who is doing what to whom and what the outcomes are, we will not be able to act in real time to change what happens in the healthcare system. We need to know, are the appropriate processes being delivered equitably, the appropriate care, real time, so that we can change bad things real time. And without that data, we don't know.
So check all those
asking
boxes.
Your listeners,
yeah, check all those boxes.
Yes, please check the boxes. That gives me ammunition to go forward and work harder for health equity.
Mm-hmm. Well, your survey found, we want healthcare providers to listen to us. We want them to spend time answering questions. We want them to personalize our health goals. I want to know, you just said, I need you to check the box. What else do we need to do? We'll talk about this before we pass the microphone off to Tavis Smiley. What's your call to action for Black Californians, for the KBLA delegation on this beautiful morning? I'm Dominique DePrima for KBLA Talk 1580.
The conversation continues right now with Dominique DePrima on First Things First.
So we've been in conversation with Catherine Haynes. The study is called Listening to Black Californians, How the Healthcare System Undermines Their Pursuit of Good Health. If you want to see the whole thing for yourself, go to chcf.org, chcf.org. It's the California Healthcare Foundation website, and you can find out a whole lot more. And you told us, Catherine Haynes, we need to start filling out, checking the boxes that say whether we're black and all that stuff. The data will help us get the results that we want. What else should we be doing? The KBLA delegation, the California Black Health Consumer, what should we be doing to improve our plight?
We should know what our health plan covers, know our rights, prepare to go to the doctor with all our questions, ask the questions. And if we do not get what we need, instead of just complaining to your sister, which we all do, we need to complain formally to the healthcare system, to your plan, And if you need to go higher, there are ways to go higher. There is the Office of the Patient Advocate at the state. Unless the system hears what our experiences are directly and formally, it will not react.
Okay, so we can go to the state office of patient advocate. We can go to whoever our insurer is. That's what you're talking about with our plan. If we have a complaint about a doctor, a hospital, or any kind of interaction that we've had, we need to do that.
Yes. And the other thing we need to do is learn how to effectively advocate for ourselves and our families and help each other. We've done a lot of work to take care of our health, and we need to protect that investment by advocating for what we need together.
When you say learn how to advocate, what does that mean? You talked about showing up to the doctor well prepared with your questions and knowing what you're trying to get out of it. Is that what you're talking about, or is there a step further that we're missing here?
That's part of it. And what we, California Healthcare Foundation, is working on right now is our materials for community members that will ultimately be downloadable to help them know how to ask questions, how to speak effectively to the doctor to get what they need, and how to navigate the healthcare system. And we hope to be able to provide additional information on resources for community advocates that people can call on to help them when they need help.
Look, I want to say to you, Catherine Haynes, and really to the whole California Healthcare Foundation and Eviterus, how grateful I am to see this data that shows that we are doing the work. We're getting the insurance, we're finding the providers, we're trying to take care of ourselves. And, sad to see the obstacles for LGBTQ plus people, for women, for people on Medi-Cal, to getting the help that they need, to the point where folks are sometimes giving up. But I'm glad to see that we're making the effort. That, to me, breaks an important stereotype that needed breaking, not just for the outside world, but for the internal conversations in our own community.
That's right. Black Californians are doing what they can, really working hard for health, physical and mental health. And what we really want, what our respondents told us, is for the healthcare system to be a partner, to meet them part their way.
Right. No one wants unrequited love. Catherine Haynes, thank you so much for being with us this morning, enjoying the conversation.
All righty. Thank you so much. Bye-bye.
And I want to remind you once again, you can check out their website and you can find out all about the study for yourself, chcf.org. I like to end with a quote. Today I'm going with health pioneer Dick Gregory. He simply says, "It's cool to be healthy."